Hello and welcome to Health Professional Radio, Health Suppliers segment. I am your host, Neal Howard. Our guest in studio today is Miss Amy Cueva, founder and Chief Experience Officer of Mad Pow. Notice I said Chief Experience Officer, not Chief Executive. How are you doing this afternoon, Amy?
I'm doing wonderful. Thank you so much for having me.
Now, Mad Pow, an intriguing name for a company. I understand you're a design agency that improves the experiences that people have with technology, organizations, and each other. Talk about Mad Pow and design thinking.
Oh, wonderful. So, right. So Mad Pow is a design firm, and we seek to improve technology and improve customer experiences. And the methodology we use is called human-centered design. And the core belief behind human-centered design is to involve the people who will be affected by the solutions we create in the process of creating them. So it's very inclusive, and we also leverage design thinking. And so design thinking is basically a different lens or approach for solving business problems, clinical problems. It's a creative approach. It involves collaboration between interdisciplinary teams. It's iterative, and health organizations are now embracing design thinking and human-centered design as a new way to help us improve patient experiences, leverage technology, innovate, and basically improve the situation. So that's what we're doing in health. We are definitely designing tools and products and improving the usability and the interface to make sure they're more intuitive and less frustrating and more effective, but we're also leveraging design to improve processes, workflows, organizational culture, weaving empathy for the people we serve into the DNA of the organization such that it informs the strategy, the direction, and the decision-making process of that organization.
So it sounds like you're looking and aiming to improve almost every aspect of not only healthcare, but business in general. And I'm assuming, the business of healthcare, you're deeply involved in changing that dynamic as well, especially with the changes in healthcare that we've seen in the last couple of years.
Yeah, absolutely. Our purpose as an organization is to improve health, help people achieve financial well-being, help them learn, and help them connect. And that mission gets our employees really fired up. And there's so much opportunity to improve the situation, especially in health, because to your point, the patient right now is left in the center of a very disconnected ecosystem to navigate it on their own. And that leads to frustrations, gaps, unmet needs, and opportunities. And so what we do is to try to help organizations improve the way that they're delivering experiences to patients. And what we're seeing right now for health organizations is that they're kind of putting innovation off to the side and struggling to integrate it into the way they do business, being that they're large, risk-averse organizations who have been around for a long time. And this new approach, leveraging technology and innovation and being nimble and focusing on the customer, it's new. So we're helping organizations along that growth.
Do you help organizations not only help themselves, but design technology for themselves, say developing apps, things of that nature, or different strategies for training their people as you see necessary in your evaluation of their situation?
Yeah, it's such a good question. We help with product design as well as organizational design and training. And the products we're working on are to help patients care for themselves and change their behaviors. If you think about it, we only see our doctor for an average of 7 minutes per visit, but we're in our bodies, right, if they're lucky, we're in our bodies 24 hours a day, 365 days a year. So we really are our primary care physician, and technology provides the opportunity to connect people with the resources, the tools, and the support that they need to actually care for themselves. So we do a lot around inspiring motivation and designing for behavior change, helping people with condition management, helping them to lose weight, eat better, look at their mood and their sleep. There's such an opportunity to leverage technology in that regard. And there's so much experimentation happening.
Now let's talk about Health 2.0. And just yesterday, I understand a press release where Mad Pow has announced the final agenda for the HX Refactored 2016 conference to be held in Boston. Talk about that conference and Health 2.0.
Yeah, absolutely. So 6 years ago, we founded a conference dedicated to exploring how human-centered design could improve health. Mm-hmm. And then 3 years ago, we partnered with Health 2.0 to expand that to not just design, but technology as well. So how do we understand the people that we serve and their needs? How do we envision a better experience for them? And then how do we leverage technology to actually deliver that experience? And so the conference gathers together over 600 people in the industry, from entrepreneurs to executives, designers, researchers, strategists, product people, clinicians, patients, anybody who believes that we need to look at experiential innovation and that design and technology can help us get there. So the next conference is April 5th and 6th in Boston, and we're going to be looking at things like behavior change and organizational design and fostering cultures of innovation, creativity, and collaboration. We'll be looking at self-care for diabetes, designing for mental health and well-being and addiction recovery, looking at how to improve clinical experiences. A clinician right now is bogged down with using technologies that are very frustrating and kind of get in the way of their jobs. So looking at that, as well as some tech stuff like big data and the latest and greatest things going on in health tech. We're really excited, though, about the conference. We'll be running design awards, design challenges, looking at interesting problem spaces like redesigning medical bills or looking at how do we tackle the opioid addiction epidemic. Yes. And we actually will be announcing a couple of really exciting keynotes coming up. So the agenda is shaping up to be fantastic.
Great. Now, as we wrap up, talk about some of the misconceptions about integrating technology into not only healthcare, but, business and this design thinking. Talk about some of the misconceptions that Mad Pow is striving to dispel.
Yeah, I love your question because, really, if an organization is seeking to improve health, if that's their mission, there's so many ways they can bring that to life. They can bring it to life through policy, through process, through, focusing on empathy training for their people. They can do it through redesigning their website to be improved, through providing tools. And so that's what I like to call experiential innovation, and it can guide and shape their product and service offering. But what companies nowadays are focused on, because technology is a thread through everything, they're establishing digital organizations. And that's great, but technology doesn't always provide us with the answer. It certainly helps, but it shouldn't be our focus. We as an industry, we can have shiny object syndrome where, it's like, oh, the latest gadget or app or emerging technology. It's like, oh, we need that. Let's figure out how to use it. But sometimes those things don't address the unmet needs and the frustrations and the opportunities present. So through experiential innovation, design thinking, and human-centered design, we can really look to address the real needs of the people we serve such that we can deliver real meaning and value in the context of their lives.
Where on the web can we get more information about Mad Pow and the upcoming conference?
Right. So madpow.com about Mad Pow, and then HX Refactored for the conference.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Amy Cueva, founder and chief experience officer of Mad Pow. Now, Amy believes that design can help improve the human condition, and it's with that mission and vision that she founded Mad Pow back in 2000 with Will Powley, and together they've created an award-winning agency serving Fortune 500 companies and startups across industries from health to financial services, technology, media, education, and hospitality as well. It's been great having you here with us this afternoon, Amy.
Thank you so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.